want to talk to you about diaphragmatic breathing. So here are the ribs here, and the diaphragm sits up inside the rib cage and attaches in and around the ribs, and it has to be able to approximate, go up and down. So oftentimes what will happen, like with golfers and tennis players, people who sit a lot or people who lean to one side, the ribs will shift and that diaphragm will get stuck. So there are things that we do to release the diaphragm, but in this video we're going to talk about diaphragmatic breathing. So the way it works is if you put your hands on your belly, your tongue will be on the roof of your mouth and your teeth will be slightly apart. Your lips will be sealed. So the flat part of the tongue goes up to the roof of the mouth. So I'm going to breathe in through my nose and out through my nose. And the way this will work is I'll put my hands on my belly, tongue to the roof of the mouth, teeth slightly apart. I'm going to breathe in and push the belly out. And then when I exhale, the belly goes back in. So this is the way it looks. So you breathe in for about 3 to 5 seconds. You exhale for 5 to 7 seconds. And all the while you keep the tongue up on the roof of the mouth and push the tongue up. And that will stabilize the vagus nerve, which runs your heart. So what that's going to do is it's going to train your autonomic nervous system to regulate between sympathetic and parasympathetic. So the sympathetic mode is the fight and flight. It's like your foot's on the gas pedal. Blood leaves the intestines, goes to the extremities. The heart beats faster. The adrenal glands overwork. And then we want to be able to regulate and come back into rest and relaxation. And that's where you bring your foot off the gas pedal. That's the parasympathetic. Blood goes back to the intestines. Heart rate comes down. You're able to digest your food better and you're able to sleep and recover. So by putting the tongue to the roof of the mouth, breathing in through the nose and out through the nose, this is a form of diaphragmatic breathing, and this is the foundational work from which you want to learn. And you'll practice this like 2 or 3 times a day. As you become more comfortable with it, you'll keep your tongue to the roof of the mouth when you're not speaking. It'll become more natural over time. And the other thing you got to pay attention to is if you get lightheaded, you'll want to just go back to normal breathing. It takes a while to learn how to breathe this way. Some people can get it in 2 or 3 days or the first few times of doing it, and other people it can take up to 6 months. So be patient with yourself, begin to practice this, and in time you'll become proficient. I'll share with you more information in the upcoming videos about how to do other things like how to stabilize your core and how to move off the exhale. So we'll see you in those next videos.